Innovative
solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone, GPS remote control for everything in life in just 5 years? Seriously.
Innovative
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Open more stuff. That's what economists call growth.
Innovative
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative
Solutions.
Mental health flows quickly, especially during pandemic. Psychotherapy sessions have become virtual, conducted on screen. In recent years, there's been more and more talk in the healthcare professions about the potential of telemedicine. This was a change made by necessity, not by choice, but there are plenty of people who like what they're experiencing. There's convenience, of course, for one thing. Patients are able to have their appointments pretty much anywhere. The question is, how much? And how is this possible? To talk about this, a senior consultant psychiatrist at the Department of Behavioral Medicine, Sultan Qaboos University Hospital. He graduated from the College of Medicine and Health Science at SQU, then completed his training in psychiatry in the UK and became a fellow of the Royal College of Psychiatrists in London in 2011. He's also involved in training junior doctors and medical students and supervising their research project. It's an honor and a privilege to have with us today Dr. Hamid Al-Sinawi. Doctor, what's the underlying reason for your study here?
Thank you, Frank. Actually, since the beginning of COVID-19, there has been many studies from different countries about the mental health impact of the pandemic, the worries that was brought in by the lockdown, the unknown, the impact of the disease, the number of deaths that started to increase all over the world. So it's kind of understandable that people will become worried and concerned. Sometimes this worry can be to the point of becoming a mental illness, specifically called anxiety disorder or depressive disorder. At the same time, we have been experiencing a little bit increase of the number of people coming to our clinic at Qaboos University Hospital complaining with anxiety and depression from different age spectrums. So we have teenagers, adults, and older adults experiencing symptoms of depression. Sometimes people will experience lack of sleep, which is a reflection of their anxiety. They'll find it very difficult to cope with the social isolation, especially those who had their family outside or the expatriate, because they experienced the worst of the isolation, especially after the closure of the airport. So they felt kind of it wasn't clear for them when are they going to be able to travel to see their family. They were worried about keeping their jobs. They were worried about the impact. So it was kind of noticeable that the number of people experiencing such symptoms has been increasing. So we thought we wanted to know. So we learned about the other countries. We read the research. We wanted to know what is it like here in Oman. Are we experiencing a similar number? And if we are, what is the best thing to deal with it while observing the social isolation, while observing the instruction from the higher committee regarding the physical distancing and the other health and safety tips. So we thought it would be interesting to, number one, answer the question: do actually we have the same level of anxiety and depression here in Oman? And if we do, what can we do about it?
What do you think are the most important psychological disorder associated with COVID-19, Doc?
So I would say anxiety and depression, as you said. Certain symptoms can be included within. So we, as I said earlier, we have experiencing people, we have came across people experiencing insomnia, so they find it difficult to fall asleep, or they have lack of energy. They have this lack of motivation, especially with the teenagers, because suddenly they're unable to go out and meet their family, meet their friends. This sitting in all the time, having no much access to physical activity, and having the online platform as the only way of expressing yourself led to other health-related issues, because people will be sitting on for a long time, just browsing social media. Some people find it very difficult, especially the elderly who didn't have that privilege, because in Oman, probably people who are over the age of 60 or over the age of 70 might not be lucky enough to be able to maneuver a smartphone or use an iPad or a laptop. So that meant more isolation for them. And also we've noticed, especially with the elderly, that's what we call a social rhythm, being able to go out to the corner shop, for example, or go to the mosque, meet the neighbors. That has all disappeared because of the lockdown and the COVID and the closure of the mosque. So this created further isolation. And what we also noticed in some instances, there is a rise in the number of domestic violence because men are worried because they might lose their jobs. Women felt they are overwhelmed because kids are there all the time at home. It's also interesting to observe some people started to notice they have been putting on weight because, comfort eating is an issue, but you are bored, you are indoors. People started to hoard for food at the beginning, initially when there was uncertainty about the availability of food and the fact that some shops might close. So people started hoarding on the food. Staying at home with little much to do meant that you are tempted to, binge eat a little more. So few people have put on weight. And for some, it became an issue because there is this concept of comfort eating. When people are stressed or anxious or irritated, they go back to eating certain food. It's usually the food that is unhealthy. It contains carbohydrate and chocolate, for example, high level of sugar. This is related to an increase in body weight, and at the same time, this makes the person feel guilty. They feel low self-esteem, and it goes on like a vicious circle. So it's all it's impacting the physical health as well as the mental well-being.
Okay, so what can be done to help these people who are affected mentally and psychologically by this pandemic?
So basically, along with the health advice, the general health advice, we have what we call the mental health advice about keeping active, staying connected with people, being able to try to stick to a regular exercise, regular routine, for example. So sleep at the same time, wake up at the same time, have a regular exercise at home if there is or wherein there is a lockdown. Also, we thought about making the use of the online platform. So this is what led us to the idea of trying to explore the efficacy, not just is it useful, but is it acceptable, and is it something that can be probably provided on a regular basis. As you said in your introduction, telemedicine has been there for a long time, but it became a necessity. The investment on telemedicine became a necessity because of the lockdown and because of the people having difficulty to access services the traditional way. So the online platform became a convenient and very practical alternative. So people don't have to drive to come to see the doctor. They can book an online session and have their therapy done. And that will be a good investment in their mental health.
What were your challenges in conducting the study, actually, Doc?
Yeah, so before going to the challenge, I'll just explain the stages. What we did, so the first question was we wanted to find out if there is anxiety in the people staying in Oman. So we designed a study looking at the prevalence of anxiety and depression. We we kind of used international scales assessing depression and anxiety, and we posted it in social media so people could fill in the scales, and we could record their score and see the level of anxiety and depression. We wanted to know also who are more at risk. So understandably, people who had past a previous history of mental illness were more likely to be anxious and depressed than others. People who are experiencing financial instability, because of there is insecurity because of the job, especially with companies closing down or cutting down the number of their staff. So there was an issue. And people who had past history of drug and alcohol, part of it, I think, is the worry that they might not be able to access these substances like they used to do in the past. So this group of people then, after getting the results, we found out around 30% of people who participated in the study were having some level of depression and anxiety. So what we did, we invited them to go for the second stage, and we divided them into two groups. One group received a therapist-led online psychotherapy session on a weekly basis. Okay. The other group were emailed instructions about how to keep your mental health, and they would have the emailed instruction on a weekly basis. So it's what we call self-help. So no therapist involved in that part. And at the end of the 6 weeks, we assessed the scores for both groups. We noticed that the group who received the therapist-led sessions did much better compared to the group that they relied only on self-help. However, both groups did score some improvement during the 6 weeks period.
We're going to be back for a bit and continue our discussion in just a while.
Innovative.
Solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone, GPS, remote control for everything in life in just 5 years? Seriously.
Innovative.
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Opened more stuff. That's what economists call growth.
Innovative.
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative.
Solutions.
Welcome back to Innovative Solutions. Group therapy can present its own challenges also, Doc. How do you do this? Actually?
Yeah, I think this wasn't actually, it's important to clarify, this was a one-to-one session. It wasn't group, because in general, some of the issues, some of the major challenges, group therapy, especially in Oman, the idea of trusting the other members in the group and having the ability to sustain the membership in the group, especially when it is people who have mental health issues. Sometimes they take a little longer to be able to express themselves in a free way among others, because it's understandable. Mental health stigma is a big issue everywhere, Oman included. So some people will shy out to share their psychological issues with others. So what we did in this particular study, it was a one-to-one session. So it's pretty much like having your own therapist, but instead of going to the office, you meet them at an electronic platform. We actually use the secure Zoom application. I mean, there are quite a few applications that are vetted and secured, and because one of the issues people are worried about is confidentiality and the fact that no one else could hack into the consultation. So we used a secured Zoom link, and it was one-to-one, so nobody was involved. Now, going back to your question about the challenges, just before I forget, the main issue was internet access, surprise. And especially because we had some of our participants staying outside Muscat, because we wanted to have this intervention as real as possible, because then the idea is that if it works, how can we roll it and make it available for everybody? So we wanted to make it as real as possible. So one of the main practical issue was the internet availability. So sometimes we would have to reschedule because there was difficulty in accessing internet services. Some people found it interesting, so we had a very low level of dropout. So dropout is usually a term used in research when people find out they are unable or not willing to continue. But in our case, people quite enjoyed it, and they were able to stay for the whole 6 weeks. And the good thing is that we trained a group of young Omani psychologists who were able to give this intervention, so it didn't cost much in terms of developing the material and making it appropriate and suitable for the cultural aspect and the social aspect, and being able to offer this for Omani people who could then benefit from. I think in general people were very happy. We always had a plan of if somebody got too unwell to the point of needing a one-to-one therapy, that was always an option, because we have still our clinic at SQ, and we were able to invite people, if needed, to come and be seen face-to-face. But luckily, everything went well online, and there was no need for that. But I think people felt kind of secure knowing that I don't have to stick to this only if I need to see somebody face-to-face, or probably the anxiety level is too high, then they might need to take medication, for example, to help them sleep or to improve their mood. So that was offered, but none of our participants needed that.
So COVID-19 infection is currently superior to any mental disorder. What is your management acute psychiatric patient with a positive history or clinical symptoms here?
Yes, I think the management will be based on the degree or level of symptoms. So if people have biological symptoms of depression or severe depression, then we will treat them as a case of depression or a case of anxiety. Usually medication might be needed, especially if the person is very distressed from his symptoms, especially with symptoms like lacking interest or not being able to sleep or eat, because this would make their mental health even worse. So we would need to intervene to help the person go back to their usual functioning. Psychotherapy would also be an option. But in severe cases, we might need to prescribe medication to help the person improve better.
In layman's terms, how would you explain your study findings, Doc?
So basically, the bottom line is that having a psychological intervention provided online is a good option. It's a practical option. It's also a smart option when and if lockdown is an issue. It also saves time for both parties because the therapist and the patient don't have to travel to a clinic. It's also the idea that people will gradually make use of their skills they learn through psychotherapy to implement in between sessions, so they would have an accumulative improvement and accumulative benefit from it.
What's in right now for the e-therapy sessions?
So basically, e-therapy is becoming more and more popular. It's also gradually being kind of tailor-made. So in the traditional ways that we have psychotherapy is kind of a general term. So you have cognitive behavioral therapy, you could have simple counseling, you could have marital therapy when there are issues related to a kind of a couple having difficulty with their marriages. There are also family therapy when it's involvement of a child. So the idea is to, the concept of trying to make all those different types more user-friendly when it comes to providing them online, because sometimes the nature of the actual platform or some of the application might not allow multiple users or users from different areas at the same time. So people are working into making e-therapies as a more available and more convenient option.
The COVID-19 pandemic posed the greatest threat to human mental health?
I would agree to that, definitely, especially that it's kind of the unknown part, because usually people talk about the physical symptoms. So in the beginning, it's understandable we saw about how to spot the signs. There are temperature measurements everywhere, but there's very little things to do with assessing the mental state. Sometimes people within the family, they might not notice that somebody is being affected. The other thing is that what doesn't help sometimes is this outburst of rumors or news feeds or WhatsApp messages or conspiracy theory that probably there's no time to cover now, but there is so much misleading information out there. Initially, it started with the nature of the virus. Was it human-made? Was it related to like a kind of a way of chemical war? And then the whole thing started with when the vaccine came, lots of conspiracy theory came around that. Is it a way of spying on people? Why was it hidden? And it makes people more and more confused. So it's unnecessary source of anxiety. Plus, we still have no sense of what would happen. We were all hopeful that 2021 will be better. The vaccine might change things. We will start traveling. We will be going back to schools and shopping and colleges and what have you. But now it's still unclear. And the worrying thing is no one seems to have the answer. So it's understandable these different factors will impact everybody's mental health.
And this e-therapy is a way to go?
I would say so, yes. It's an option. It doesn't have all the answer, but it's an option that we could make use of more. We could probably provide it, and we could train our young psychologists to become more efficient and get the right skills into using it.
So according to Doc, this study shows a result that could work both ways. Effectiveness of e-therapy for symptoms of anxiety and depression during the COVID-19 crisis here in the country. Really a brilliant research, and I'm sure of that. Again, congratulations, Doc. Thanks a lot for being here. It's an honor and a privilege to have you in our program, Innovative Solutions.
Thank you, Frank. The honor is mine. Thank you very much.
Okay. Any final words before we wrap things up?
Yeah, I'll just say, remember, mental health is as important as physical health. Don't be worried that people might judge you. It's your responsibility to look after yourself and seek help.
All the best and more success to your research as well as your upcoming plans in the future.
Thank you, Frank. Thank you.
Okay. That's Dr. Hamid Al-Sinawi, a senior consultant psychiatrist at the Department of Behavioral Medicine, Sultan Qaboos University Hospital, graduated from the College of Medicine and Health Science at SQU, and a fellow of the Royal College of Psychiatry in London in 2011. He's involved right now in training junior doctors and medical students and supervising their research project at the same time. For Innovative Solutions, my name is Frank. Thanks for listening.
Innovative
Solutions. Can you imagine how much genius and focus it took to turn a music player into a handheld computer phone, GPS remote control for everything in life in just 5 years? Seriously.
Innovative
Solutions.
The more you know, the less you fear.
Revolutionize business models and make old ones obsolete or not. One thing is for certain, today we compete on service, price or innovation, and the expectations and metrics around each are tighter than ever.
What's working, what's not, who's competent, who's not.
And that's all about how do you deal with failure.
Opened more stuff. That's what economists call growth.
Innovative
Solutions.
Prepared and presented by Francisco Porras Jr. Weekdays here on the Nation Station.
Innovative
Solutions.